My name is Dr. Samir Puri, and I'm the founder of CerecDoctors.com. I'd like to welcome you to this video where we discuss the benefits of using a microscope to aid in the treatment of our patients. As a longtime Cerec user, one of the most valuable tools that is in our arsenal to create well-fitting restorations is the use of magnification. Magnification allows the Cerec clinician to see all of the things that the bare eye has a difficulty in seeing without assistance. Considering that the Cerec design of a restoration is typically completed on a blown-up model on a large monitor, it is important that the clinician provides the Cerec system with the proper preparation for the machine to fabricate restorations with the best possible marginal integrity. To get the best possible marginal integrity with Cerec, the key is smooth and polished margins. Because of the way that the milling unit mills the margins of the restoration, the requirements from the system is that the margins must be as smooth as possible. The analogy that I give at our hands-on workshops in Scottsdale is that the margins must be glass smooth. Now, there are numerous techniques and instruments that can be used to fabricate glass smooth margins, from high-speed hand pieces to hand instruments. However, the common bond between all of these finishing techniques is the ability to see what you are doing with proper magnification so that the clinician can view the margins with ease. This is where a microscope becomes invaluable. Another reason that I've personally used a microscope for years is that it simplifies my ability to document cases for educational purposes. This is critical for someone who is presenting cases regularly. Having the case documented through a scope in either video or still format is an invaluable tool for both doctor and patient education, as well as to contain any potential medical legal situations that invariably may arise in a clinical setting. With the importance of magnification and documentation discussed, one more benefit for using a microscope is ergonomics. Dentists are notorious for poor posture, and there's little doubt that the microscope can be helpful to help correct this posture. Having said all of this, one of the more advanced microscopes that is currently available for use by practitioners is a Seiler Evolution Zoom. There are numerous features in this microscope that many clinicians have found beneficial to make the scope easy to use. While Seiler makes several different models, one of the features that is unique to the Evolution Zoom scope is a motorized unit with many of the common controls built into the unit itself. With a fully motorized focus and zoom that is directly on the handles, easy adjustment to the viewing field can be made while the doctor is working on the patient. These adjustments through the motorized unit include adjusting the magnification, light intensity, as well as the focus. The fine focus system is built directly into the handle, which allows for precise adjustment of the focus of the operative field. Unlike other scopes, the operator only needs to press the motorized focus button to change the focus of the operating field. Manual movement of the actual scope to adjust the focus is inefficient and cumbersome and is not necessary with this automated technique to get the most clear picture. If the clinician's hands are occupied and involved in the procedure and moving the hands is not desirable or inconvenient as it will disrupt the flow of the procedure, a foot pedal is available that allows the operator to adjust the focus, magnification, as well as the light intensity, all while keeping the hands occupied in the procedure. These are the same features that are controlled by the motorized unit mentioned previously. However, these features can be controlled without the use of the clinician's hands at all. The light on the Evolution Zoom scope is powerful and efficient. Because it is an LED light that has over 100,000 lux, it has a projected lifespan of over 50,000 hours. As mentioned previously, this LED light can be controlled by both the motorized hand-mounted control or by the aforementioned foot pedal. The Evolution Zoom lenses are designed to have no spherical aberrations, which in layman terms means that the colors are rendered through the optics are true and with excellent resolution. Because the scope is available on wheels, we are easily able to move the scope to anywhere in our complex. This becomes necessary as we have workshops on the second floor and our clinic on the ground floor. The scope is used in many of the workshops to demonstrate procedures as well as during the routine course of patient care. While the Evolution Zoom scope is a great motorized and fully automatic high-end system, some offices may opt for a more basic version of the scope from Seiler. To serve the needs of these clinicians, Seiler also makes their Air Series scope. Their new design is more sleek and modern and is currently the lightest Seiler scope on the market, which makes moving the scope from operatory to operatory a breeze. The scope has a new, longer pantographic arm that is coupled with a new angled arm that allows for one of the smoothest movements of the microscope head on the market. The Air Series scope also uses an LED light that is 150,000 lux in brightness. This currently is the brightest LED on the market for any microscope, easily lighting up even the most cramped of oral cavities for easy viewing of the operative field. In discussing the importance of documentation earlier, there is a USB port directly on the optical pod so that you can easily attach either a still or video camera or have the USB port available to continuously charge any type of camera that you may want to use for your documentation. One of my personal favorite features is the ability to attach a specially modified GoPro camera directly to the Evolution Zoom scope. With the GoPro Backbone Series Hero 4 attached through the optional beam splitter accessory, you can document live with either 4K or 1080p videos and take 12 megapixel still images as needed. The Backbone Series GoPro is a nice documentation device to use due to its low cost and relative ease of operation. Simply place a micro SD card into the port and record your video. Then remove the card, place in your computer, and edit the videos as needed. The Evolution Zoom actually has two optical ports that allow you to attach the Backbone Series GoPro video camera on one side and an SLR still camera on the other. This gives the clinician the flexibility to record separate still pictures as well as live streaming video at the same time. Having practiced dentistry for close to 20 years now, I cannot stress enough how important it is to have a clear, clean, visual field to work in where you can clearly see your operative environment. A microscope is an excellent adjunctive tool not only for doing more complex procedures like endodontics, the benefits here are clearly known, but also for more routine procedures as crown and bridge and simple restorative work. The ability to visualize your operative field, maintain your ergonomics, and give you the ability to document your cases with either still or live video make the microscope an incredible tool in the clinician's tool belt. I personally found that the learning curve of this scope to be minimal and the benefits tremendous. If you have not used the microscope in the past, I encourage you to try one and see how it can benefit your practice. The Evolution Zoom and Air Series are excellent examples of well-made microscopes. For any further questions, please do not hesitate to contact either Seiler or post your questions on the Cerec Doctors discussion forum. Thank you for watching this video, and we look forward to demonstrating the microscope to your next visit in Scottsdale.